welcome to our next mental wellness and recovery series. It is Tuesday night. It is a good night because we're going to be visiting with two incredible ladies today, covering some really important topics that don't get covered enough, honestly, in our community. And so we're so thankful for Leslie Dean here with Ellis County Children's Advocacy Center and Noelle with Discovery Point Retreat, both representing organizations that are proactively invested in the mental health and wellness of our community and the safety and health of our children. Specifically today, we're going to talk about all these things. So I'm going to toss it to Noelle and she can take it from here.
Thank you so much, Heidi. Hi, and welcome to, so we're calling the show Discover Community Connections. And as Heidi mentioned, we will be here weekly to offer mental health and recovery support for anyone who reaches out. Our contact information hopefully is at the top of this post. But most of all, we want to offer connection for our entire community. Connection with real life boots on the ground heroes, Leslie, and local experts who can really inform us and guide us through this crazy, unpredictable time. So especially as we've been isolated and left to our own coping mechanisms, that may or may not be helping us. If you are struggling with addiction, I just want to say, please call 855-916-3289. Don't feel like you're alone. Please reach out. Again, this is all about connection. So now I'm just so excited to get to Leslie, the feature of the afternoon here. So we have Leslie Dean with us. For those of you who may not know, she is the executive director of Ellis County Children Advocacy Center. Leslie, have I said that correctly?
Yes.
Welcome. Thank you so much for taking time to talk with us. You have been doing an amazing job in our community meetings, and I'm really excited to introduce you to people who may not really know what it is that you do. So will you tell us a little bit about the Advocacy Center and what it is you do as executive director?
Well, Noelle, thank you for having me. It is an honor and a pleasure to be a part of this. I love everything community, and because this is my community, I grew up here in Waxahachie. And so as a little kid, social justice was something that was very important to me. In the Advocacy Center, our role is to facilitate joint investigations of child abuse. So we work with Child Protective Services, law enforcement, the district attorney's office. We have partners that we work with and have working protocols and a memorandum of understanding to work together so that we can jointly do child abuse investigations.
So you guys are basically like a hub, it sounds like, where you kind of connect all of the different pieces to protect our children.
That's right. It's exactly.
That's awesome.
If you see the infographic about what the Child Advocacy Center is, we are the literal hub in the middle, and you have all the arms of the different systems that we work together. Because if you can imagine these systems, they're big systems, the justice system, law enforcement system, child protective services, those are all, if they work in silos, that's when people don't catch things and kids can fall through the cracks. So our model is one that works together with already existing systems to kind of keep us on track and make sure that we provide a neutral environment for kids and keep the kids first.
So I can see where if you guys didn't exist, the left hand wouldn't know what the right hand was doing. And so that is very dangerous if you guys didn't exist, because I can see where it would be easy to not identify children who really needed some serious help.
Yes. In fact, we were born out of that need. We were born out of it. Was not just somebody said, hey, I think that'd be a good idea to have this place where kids could go to. It was born out of the need from law enforcement and DAs and Child Protective Services saying, we need this. And so because of that, because of where the need came from, 20, 30 years ago, it has brought strength to what we do. It has brought where we have legislation to help us to define what we are and who we and how we serve. And it's also helped us with funding to be able to fund the nonprofit part of what we do. And then the other thing is just the prevention of abuse, getting out in the community, teaching kids how to prevent themselves from being abused. And we'll talk in a little bit about the nuts and bolts of what we do. Me as an executive director.
You just took the question. I was just going to say, tell us about what you do as executive director. You went right into it. What am I here for? Nothing. Just ask your own questions.
I'm sorry about that.
No. I think it's great.
I was just thinking, for me, my job is to do these kinds of things, is to talk to the public, to let people know what we do and how we do it, because we depend on our public so much to be the eyes and ears to protect kids. And so going out into the public, doing public speaking engagements. Last year I did about 96 public speaking engagements, and I think it was about almost 4,000 people that I was in.
Wow.
And so it's teachers, it's administrators in the school systems, because they're like our first responders to child abuse, the ones that are making the majority of reports, because they see kids every single day, and they notice whenever a kid comes in to school that day and their mood has changed and there's a dramatic shift in their behavior. And so those school teachers, and we need to get in front of them. The other things that executive directors do is we have a board of directors, and so I work with them. They're kind of my co-pilots in making sure that we have a really strong foundation for which to serve people. Working with the board, we do fundraising activities. And then just the overall organization, the vision, where are we going, how are we going to serve more people? That's my day-to-day job. And I forgot, the most important thing is the people that are serving the kids directly. So that is my frontline staff, my forensic interviewers, my family advocates, my therapists. We have to work to help them because they are helping the kids. So
that sounds like a huge job, a tremendous amount of responsibility. Do you ever feel like, you need an executive director for yourself to just go to just kind of download and decompress yourself? Because that sounds like just kind of a heavy burden to bear sometimes.
I think it's real important to have mentors and to have a good network of people that do your type of work. And then some people that don't do your type of work to have good, to bounce things off of. So I look to the business community a lot because, nonprofits, although they're not in it to make profits, they're in it to be a business. And so there's a lot of things that you can learn from the business to make it to where, to me, it's like, I can serve more people. Instead of I can make more money, I can serve more people if I do this right. So I am reaching out constantly to people to help build me up. And I try to surround myself with people that do an excellent job in their own jobs. It makes it feel a lot more easy whenever they are experts in what they do.
I absolutely love your passion. And even though we're not in the same room, I can feel it just coming through the computer. I just absolutely can see that you love what you do. Dying to know how you got involved with the Advocacy Center. Like, where did you come from? I know you grew up here in Waxahachie, but how'd you get here?
Okay, well, in about 1997.
A long, long time ago.
This is the 23rd year. I started working at a residential treatment center for emotionally disturbed children. And I was a frontline group leader working with kids who had lots of trauma that they'd experienced through child abuse, neglect. These were kids that were removed from their families. They could not make it in foster homes. This was kind of a last-ditch effort before, at the time, kids might go to state school they're going to start getting in trouble with law enforcement or having bigger issues. So our job was to get to what was on their heart and help their traumas so that they could make it in foster families. So in that work, that's what sparked this huge fire in me, to help kids that were abused and neglected and figure out what it was that I could do, what were my skill sets that could bring about that. So I quickly went up into the clinical aspects I was on the clinical team. I was a clinical secretary. And so I learned a lot about the clinical piece, the therapeutic piece of treatment. And then years later, I became a licensed administrator for child placing agencies. And so I worked in the foster care system for about 21 years total, before coming to the Advocacy Center. So that background of working with foster children, working with foster homes, dealing with the result of abuse and neglect, when this job became available in my hometown, in my county that I grew up in a field that I felt like I could really make an impact, I was like, sign me up. All these years of experience that I think me. A few years before, I started working on my MBA because, in social work school, they don't really teach you about budgets. They teach you about feelings. And when you run a nonprofit, you have to know those things. You have to know what a profit and loss statement is and a balance sheet and all that stuff. So I went back to school and got my master's in business administration. And I think all of those things combined just prepared me to be an executive director, and I absolutely adore it. So
you are my hero. You're amazing. Really.
Well,
were you getting your MBA while you were also executive director, or did those things happen together at the same time?
So I was leaving foster care, and before I left foster care, I started working on my MBA. And I started a little consulting business right when I left foster care, and I was working on my MBA, finished just starting to, and so the job came open, and I got it. And then within a few months, I finished my MBA.
So when are you running for president of the United States? Because your accomplishments are just amazing. You mentioned something.
I don't see it like that. I see it like I have a need. I don't have that experience, or I don't have that skill. So in order to do what I want to do, I got to go get that skill. So I don't think it's all that big of a deal.
I mean, that's the heart of a public servant right there. Just listening to you talk, it's all about what can I do to serve my community, and it is a beautiful thing to watch, I must say. I wanted to get back to something that you were talking about, trauma, because we keep, I work in substance use disorder. You work with abuse, neglect. We see it over and over in our society, and it always comes back to trauma. So I just want to talk about the nature of trauma a little bit, because I think it's actually material to how we serve the community, being able to talk about trauma, being able to identify it, and start to heal it. Because, man, coming out of COVID, we are going to see the effects of trauma.
Yes, we are. I feel fortunate that you'll hear the buzzword trauma informed. You hear that a lot when you start looking into what practitioners are doing now. They want to be trauma informed. And the reason for that is because once you have learned about trauma and how it affects our biology, or how it affects our brain in the decision-making process that we have, once you know that, you can't unknow it. You see people in a different way. You're seeing it through a lens of potential trauma and how they're responding to it, as opposed to, so we used to ask the question, what's wrong with you? what's wrong with you? What's this disorder? We're gonna
Yeah.
label you with what's wrong with you. And now we think of it differently. Being trauma informed thinks about people as what happened to you.
Mm-hmm.
And so that's a real different way of
Mm-hmm.
treating people. And
because the significance there, and I'm sorry to interrupt you, but the message changes from there's something wrong with you to something bad happened to you. How can we together bridge the gap to get you to a better place? So you're not this permanently damaged being walking around. Something bad happened to you, but you're still okay. You're still preserved. And I think that's such a powerful message in terms of someone knowing, well, okay, I can move out of this. I can have different behaviors, different attitudes. So don't you feel like that's such an empowering way to let people be aware of themselves and others?
I do. And I also feel, as someone that intersects with people that have experienced trauma a great deal, it really helps me to help others. If I'm looking at things through a lens where I have a better understanding of what is going on with a person, what is going on in their brain, what is going on with their body, and what's in their control, what's not in their control, it really helps me to not take things personally. How many of us, when we see someone that's having a trauma response, are blaming of people, and
Yes.
we don't have a good understanding of what's really going on with that person. And if we did, we would respond differently. Mm-hmm. And so the more we can get out this message of how do you work with people that have experienced trauma, the better. It's not just for people that do it for their jobs. It's for someone that interacts with a person on the street. It's for law enforcement that come up to someone that's responding in a way that's not normal. They may have a response that doesn't look right to us. But if we have an understanding that that person may be traumatized, we may respond in a way that is more helpful.
There's that idea, and I know there's a famous saying, I don't know what it is exactly, but the notion that someone's behavior is really more about them than you. And it does help you to separate out and be able to be more of a help or be more kind than maybe you normally would be.
Yeah, I truly believe that.
So tell us some of what life looked like for you guys pre-COVID versus now that we are in the midst, and coming out to a place where we're cleared to gather. Give us that whole transition so we have some perspective as to what it is you and the Advocacy Center are going through.
Let me first just explain kind of the three sides of our program. We as a part of what I described earlier, where we work with Child Protective Services and law enforcement to do these joint investigations, that's really one piece of the whole program. So we do forensic interviews on a daily basis. We have children that come in for interviews. They may be a witness to domestic violence. They may be a child that made an outcry to a teacher. They may be someone reported it on the child abuse hotline. It may be there was a child death, and so this may be a sibling or a person that a child that may had been involved in that, or maybe was just in the household. And so there are really lots of reasons for children to come into the Advocacy Center. So forensic interviews is one of them. The other thing that we do is family advocacy. So we have a family advocate that meets with the families, because many times families that are going through a forensic interview are also it's possible that they have other needs. Like we had a mom who needed, her husband was a military guy. And so when this abuse happened with her daughter, she lost her housing. She lost, because she lived with her in-laws, she lost, she didn't have a job. She hadn't had a job in 6 years because they moved around a lot. And so she had more than, she called us and said, I'm having problems with my child's behavior. So at first we were looking at how can we help her with the child's behavior. But then when you look at really what's going on with the family, she had huge gaps in resources that she needed. She needed someone to help her know what to do about this job. Who better to do that than Women's Job Corps people, that we already have in our community. The housing issue, our family advocate linked her up with housing in our area, people that already exist that are here. So that family advocacy is about linking families with resources that need them.
And there you guys are again, being that hub we talked about. Here's someone who has multiple needs, not just in one direction, but in several. It's such a powerful thing that you guys do. I didn't mean to interrupt you, but just wanted to point out that hub, the way that you facilitate in that way.
It comes around quite a bit. So the next thing, and I will also say that I really feel that families, and I learned this through the foster care system, is that relationships with children are so very important in the healing process with them. And if we can help heal families and build them up and get them the support that they need to function better, then we're going to help that child to be able to heal. If you're working to help your child who's in the hospital with cancer, but you're not able to make your house payment, or you don't have a job, or you have all these other stressors, how much are you going to be able to help your child that has cancer in the hospital? So it really helps the child to be able to strengthen the families. So the last part of what we do is our therapy services. So we have families that come in that need, they don't know what to do with this grief that they're going through. Their child's been injured or hurt. So these are non-offending family members that we work with the victims and do a very specific type of therapeutic intervention, which is trauma-focused cognitive behavioral therapy. It helps trauma victims that go through a process of resolving that trauma. But oftentimes the family members, the moms or dads, and siblings are affected by abuse that happens. And so we can help the whole family, not just the child that was affected. So that is us in a day. That's what we normally do. So that's before COVID. We have kids coming in and families coming in for forensic interviews. We have a busy, partners that come through our doors, police officers, child protective services. We have therapeutic services that are happening. So moms and kids and dads are coming in our waiting areas for therapeutic services. And sometimes they're there all at the same time. So when the COVID, I think when I learned about that things were going to change was my son. He's 18. He's a senior at Waxahachie High School. And they were coming back from their theater trip in New York. And I'm learning that they're probably not going to go back to school after spring break. And at that point, I go, this is serious. This is going to affect what we do and how we do it.
And little did you know there wasn't going to be any toilet paper. I mean...
Oh, I guess I'm because I didn't go out and rush. And then I started really worrying about it. Like, are we going to have enough toilet paper?
I did the same thing. I was like, guys, they said the toilet paper was diminishing, and I think our house is running out of toilet paper. This is a real concern. So it was, I know what you're saying is like, I feel like it was dawning on our whole community. Like, what do you mean the kids aren't going back to school? And what do you mean there's no toilet paper? This is serious.
Right. And then once that's gone, like, what do you do? I mean,
yeah, right?
I don't know what you would do, but
you get the socks that are mismatched. That's what you do.
Oh, I hadn't thought about that.
Yeah, it's a problem.
We got the double rolls. We had double rolls in stock in our tree, so it lasted us surprisingly a long time. Now we know exactly how long a thing of toilet paper will last in a family of 4.
Right? I feel like I'm going to have like toilet paper trauma for a very long time. I really do.
I remember my brother saying, this is never going to happen to us again. I'm like,
Right?
okay, well, is it just going to be the toilet paper that we keep, anyway.
But to your point though, we're joking, but at the same time, it's a serious point. I mean, when it was dawning on us, it was all hitting the fan.
Do you remember the whole talks about who's essential, who's non-essential?
Oh, yes.
So, I mean, I know that child abuse continues to go on. Child abuse investigations have to happen. It is a public safety need that we have to keep kids safe. And so at first we were like, we're not changing anything of what we're doing. We're here, we're going into work every day. And then we have had to really be flexible and find ways to continue to serve the kids that need to be served and do it in a way that keeps people safe, my staff safe. So what it looks like is I have 2 people that can do forensic interviewers. They're not in the building at the same time, okay? Because if I lose my forensic interviewers, then we have to ship forensic interviewers in from Dallas or Cleburne or, from Tarrant County because forensic interviews have to be able to happen.
And forensic interviews, just to be clear, because I'm not sure that everybody is going to know what a forensic interview is. This is when there's a problem with the family. Correct me if I'm wrong. I might be speaking out of turn, but where the family comes in, there's a problem, and you guys are trying to sort through the problem and figure out what happened to who to be able to give the proper care. Am I right? Am I wrong?
I'm going to give it kind of a definition of it. So
okay.
That does happen. The sorting through what happened sometimes happen, but our job is not to make it. We're a neutral party, so our job is not to make a determination of what happened. Our job is to give a voice to the child. So the forensic interviewer is a trained social worker specifically on how to forensically interview children in a non-biased, culturally sound, legally sound way. So forensic interviews are a part of an investigative process. So for adults,
Gotcha.
Instead of doing, an adult would just go to the police station and have an interview with the police officer. Police officers are not trained to speak to kids in the way that we are. So we have to keep in mind civil law and criminal law when we are doing forensic interviews, because they could be used in any of those courts. So it is a very, they follow a semi-structured process in how they ask questions, because we don't want to ask any leading question. Our job is to allow the child to tell their story and whatever story that is. So the forensic interviewer is a very specific job that they do, that they are usually social workers before they get into forensic interviewing.
So now you're keeping your interviewers separate. They can't be in the same building at the same time, because if one of them gets sick, then the other gets sick, then you're in trouble. So what other changes have you made to accommodate for COVID?
So we also had lots of visitors that would come by, people that would just stop by our building to do donations, or people that would come and do tours of the center to learn about what we do. And, we had to make it to where our building was open by appointment only. So we've had to, and so that quickly changed. And then we started doing where, we're having to make all these decisions. Like, if you're in front of a child, do you wear a mask?
Wow.
Everybody's temperatures going into the building. How do we do this? How do we do this in a way that is HIPAA compliant? How do we, make sure that my staff are safe and law enforcement is safe and child protective service workers are safe? So we have had to clean. We clean in between. We spread appointments out where we don't have crossovers of families in the waiting areas. And the most exciting thing that I can think of is that we have started telehealth, mental health via, we use a system called DoxyMe or Doxy.
So I want to make sure to get your contact information here at this point. So when we're talking about telehealth, we're talking about all of the services you guys offer.
Mm-hmm.
I want to make sure that we get to what it is you're seeing in the community, because our hour is starting. I'm aware of the time here. So I want to make sure that we hit all of these important parts. It just sounds like you're making incredible strides to address all of these COVID issues. Tell us your contact information first to make sure we get that to people.
Okay, so if you're curious just to find more about the center, you can go to our website, and that is elliscountycac.org.
Can you say that again? Say it again.
Yeah, Ellis County, spelled out, the letters cac.org.
And do you have a phone number for us?
Yes, our phone number is 972-937-1870.
Leslie, can you quickly speak to, God, and I hate to rush you through this information. I want the community to hear about what it is you're seeing, because these realities need to be out there in the community so people understand what it is now, mid-COVID and moving into post-COVID, what it is we're up against. So tell us what you're seeing in the community, so people can be very aware of how serious this is going to be moving forward.
Okay, I'll try to be very succinct because I can talk.
As can I.
One of the things that concerns me the most is the drop in the number of statewide intake calls that across Texas and specifically Ellis County has received. So across Texas, there's been a 40 to 60% drop in the number of calls made to the statewide intake hotline. So that's the Texas Child Abuse Hotline. That number is highly publicized, but that's the number that professionals, people in our community call whenever they suspect abuse.
So what would you say to somebody who said, well, there's a drop, that's a great thing, that's, less trouble happening. What is your response to that?
So we have trends of those drops, and usually it's when kids are out of school. And so it's a normal trend to have a drop during spring break. And then as soon as kids come back to school, you have an uptick in the calls and things kind of level out and go back to normal. So with this, and specifically in Ellis County, we've had a 50% drop in the number of calls. But the things that we are seeing are more domestic violence issues where the police are having to be involved, and that's then how we're getting a report. So we're seeing those kind of calls. We have had since March 17th, which in my mind is kind of our date of when things kind of really changed for us. We've still had 38 interviews that we've done for kids, and just recently has picked up. What I would say is that we categorize families whenever they come to us in different red, yellow, or green. And that kind of helps us prioritize what families' needs are. And out of 30 families, 19 of them were in the red and yellow area. So also, what else have we seen?
Just to stop you there. So what you're saying is we're not only in trouble, we're in greater trouble because of what's happened in COVID. So we can't use the drop in calls as an indication that things are better. They're not. They're worse than they were. And moving forward, the need for child advocacy is going to be greater than it ever has been. I talk about this. In my mind, it's like the tsunami. And in a tsunami, before the wave comes, there is a receding of the waters. The waters pull out, and then you have this big flow of water that comes. And I feel like that's what we need to be preparing for. So tell us again, Leslie, who you are. Tell us what your mission is, and give us a message of hope as we close this conversation, so that people have something to take back with them moving into this next phase for our entire community.
So I feel like that in the past, we've depended on teachers to be our eyes and ears and notice when children are in tough places. We need all of the community to keep their eye out for kids that are isolated, families that have never experienced trouble like this before. There's going to be people put under stressors that haven't been here yet. They don't know how to access resources because they've never had to.
Right.
And so people in our community need to work together. They need to help people find resources. And they need to report things whenever they see something that they think is wrong. It's not, can you prove if something has happened to a child? It's you are supposed to report suspected abuse, and we will help sort those things out. And we will also offer the family resources. So it may not be abuse that's happening, but that doesn't matter to us. Even if abuse is not happening, we're still going to offer the family resources if they come to us.
And here is a key point. I don't want to close out the show with saying, oftentimes all of us tend to say, that's someone else's problem. That's not my problem. They can figure it out. I need to not get involved. But sometimes that can be very dangerous for a child who cannot protect themselves. Would you, as the expert, would you agree with that?
Absolutely, I would agree. I would agree that we all have to be involved. We have a level of safety net that is gone right now, and that is our schools. We depend on them as our first responders to child abuse. And so with that, our community does have to step up, and our children they're our most vulnerable population, and they're all of our responsibility. Because the children can't always have a voice for themselves. And so our mission is to provide justice, hope, and healing for families and victims of child abuse. And, when those calls are made, if the child comes to the center, we're going to come to that family with the hope of healing and providing hope for them and providing them resources. So it's not all the doom and gloom, horrible things that people think.
It's help. It's help.
We could prevent a lot of things in the future. And that is what is exciting about the work that we do, is that we have an opportunity here to be on the front end of when abuse is happening with kids and really change their life.
Leslie Dean, thank you so much for taking time to speak with us. Honestly, it's an honor. You're amazing. We are so lucky to have you as a local hero here. Thank you so much. And I just want to say to our listening audience, our viewing audience, actually, thank you so much for being here, spending time with us. If you are struggling with addiction, or you know someone who is struggling with addiction, please don't hesitate to call 855-916-3289. Heidi, I'm going to turn it back over to you. Thank you so much to the Chamber, you and Sandy, for hosting this and letting us have this great connection with the community.
Hey, we're grateful. Thank you, Leslie, for being here today. It's very, very invaluable, the information that you've shared. We are very grateful to Noelle and Discovery Point as well for making this happen, drawing awareness where it needs to be drawn. And we will post these links and these hotline numbers for you guys so that you have that with this video. Everybody take care, stay safe, and we'll see you guys when we rebound from this. Bye, guys.
Bye.
Bye.